So over to Dr. Miss Arya.
Yes, am I audible?
Yes.
Okay. Good evening, everyone, and welcome to the 1983rd episode of the uninterrupted webinar series of the International Forum for Promoting Homeopathy. I'm Arya. I'm a third-year student from Madhurashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. And today, we have with us a distinguished academician, PhD scholar, and a researcher, Dr. Suraj Singh Bhadoria, currently serving as the Assistant Professor of the Department of Homeopathic Pharmacy at Parul Institute, Vadodara, Gujarat. He has presented numerous research papers at both national and international levels, and he has also been a frequent guest at IFPH platform. So we welcome you, sir. And today, the topic is the second part of material sciences in homeopathy. And we welcome you, Dr. Suraj Singh Bhadoria. The platform is all yours.
Okay, first of all, good evening to everyone. Today our topic is very important to discuss about the nanoparticles and the microstructures in regards with the homeopathy. So now I am going to share my PPT with you. Just wait it. Is it
Yes, sir. The
visible?
screen is.
It,
Yes,
it,
yes, it's visible.
okay, slides is visible, ma'am.
Yes, sir.
Okay, okay. So today our topic is material science in the homeopathy. So what is material science? Because it is a very huge branch. So before entering into homeopathy, we must know about material science. So material science is generally it is a part of the science which derive or study the structure of various materials, the morphological and the chemical and the physical property of the various materials and their effects for the action for the various propagation. So the process and the performance of such materials and the nanostructure or the minute particles or the microfilaments in the real life is known as a material science. So material science exists in every ground. When we talk about engineering, so again there are certain materials like carbon element, like graphite, like some other nitrogen, phosphorus. When we talk about the medical field, so we have various calcium and the mineral substances. So these are the various fields through which we can we can make this plan of material sciences and their utility in a different perspective. So generally, material science, the core idea is first the structure. So here you can see in the structure, we talk about the atomic arrangement, we talk about the crystalline structure, we talk about their defects, we talk about the pattern of arrangement of such atomic structure, the crystalline material. So this is the morphological features of the material science. The second is the properties. The properties, when we talk about the properties, so we always have the mechanical action, we always have the electrical property, we always have the thermal property, we always have the magnetic property, we always have the optical density. So this is all about the properties of the material science. The third one is the processing, the casting, the endothermic reaction, the exothermic reaction, the synergistic reaction, the deposition. So this is all about the processing. So the processing, it needs to make the entanglement of various materials, various atoms, various molecules, various microfilaments, various microstructures, various solute and the solvents, particles. So this is all about the processing of such material science. The next is the performance. So here the performance is actually based on the behavior of such material and such atomic and the molecular formation. So this is about the performance of the material science. The next is the main classes of materials. So in general, when we talk about the classification of material science, so the first one is the metals and alloys. So they have steel, they have aluminum, they have titanium. So this is all about the metals. This is all about the alloys. So these are generally used for the making of different union of the fractures, or some different making of the artificial bones and some other surgical intervention. So this is the use of such metals and alloys in the medical fraternity. When we talk about the ceramics, so generally it derives from the glasses, oxides, nitrides, and various hard instruments. So generally these are the ceramics. So generally it gives the strength, it gives the rigidity to that particular part, to that particular morphological feature. So we want that rigidity. So this is very important part, that is ceramics. The next is the polymers. So generally polymers are plastics, rubbers, biomaterials. So these are used for the flexibility. These are used when we want motility, when we want movement, when we want some flexibility in the materials. So these are the polymers. The next is the composites. So generally composites are always made by the carbon element, their fibrine, their fibrous glasses material. So these are the carbon element. So the compository plays a very major role in any type of material science. Suppose the carbon element is more, so it is more rigid. If hydrogen is more, so it is more flexible. If oxygen is more, so it is more fragile. So the compository plays a major role in any material science. Next is the semiconductor. So here this silicon and some other gel, these are used as a semiconductor. So we at that time we want both the flexibility as well as the rigidity. So the mixture of this flexibility and the rigidity plays a major role in certain instruments. So this semiconductors plays a major part for deriving such action through the material science. The advanced materials, generally now this is important for us. So the advanced material is nanomaterials, the nanoparticles, the smart materials, the meta materials. Why they are said to be smart materials? Because these materials are going to act on the specific part of the body. So the action is very specific, the origin is very specific, the structure is very specific, the chemical property is very specific, the physical property is very specific. So everything is very unique and specifying. So that's why it is known as a nanomaterials and the smart materials. So this is about the advanced material science. So these are the different classes of the material science. And when we talk about such material science, so we always have a different action, we always have a different propagation, we always have a different materials, we always have a different chemical and the different compository. So this is very important classes of the material sciences. The next one is, now when we talk about the examples of metals, so generally there is stainless steel, titanium alloys, cobalt, chromium alloys. And the use is generally, as we already taught about this, it is used for the bone plates and screws, the joint replacement. When we talk about the chronic osteoarthritis, rheumatoid arthritis, or any type of knee replacement therapy, hip joint replacement, because of the arthritis, because of the chronic condition, so these materials has been used for the replacement of that particular part. So this is very important aspect of the use of material science. The next one is the ceramics. The ceramics are generally the various examples of this alumina, zirconia, and hydroxide pellet. So these all are the various examples of ceramics. So this ceramics plays a major role because ultimately it makes a heterogeneity in the multiple compounds. Because suppose if we have A element, B element, C element, D element, so on. So when we mix A with B, B with C, C with D, so we want the heterogeneity. So the making the heterogeneity in between A and B and B with C and D. So we want the ceramics material. So this ceramics makes the bond and the integration, the interlinkage in between the two different element and two different compound. So these are the ceramics. The use is dental crownings and the bone substitutes. So these are the major aspect of ceramics. So generally we use it. It is very commonly used. So these are very important part for such surgical intervention. Next is the polymers. The polymers are generally the polyethylene, the PVC, the silicone rubber. So generally it is used for the catheter, artificial heart walls, because again here we want the propagation with the flexibility. We don't want rigidity, because if there is a rigidity, so it causes trauma. It causes rupturing of any blood vessels or any urethral passage. So in that condition, we want that material which is flexible, which is not hard, which is not too much rigid. So these are the polyethylene, PVC and silicone rubbers. So they are generally used for such catheterization or artificial heart walls, replacement of the natural walls. So these are the examples and the use of polymers. The next is the composites. The composites, generally when we have this carbon fiber, reinforced polymers, polymer ceramics compository. So these are the combination of different elements. So these are used for the prosthetic limbs, bone repair materials. Again, these are used for the flexibility. These are used for the purpose of some function. So these are the compository. So these are composites. It is the basic elementary part of both A and B and C and D. Means carbon, hydrogen, hydrogen, carbon, nitrogen, carbon, 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 hydrogen, hydrogen, carbon, and some other arsenic. So this is all about the composite. So it is the mixture of different element in a different concentration, in a different heterogeneity, in a different interlinkage, in a different proportion. So this is about the composite. This is very important part to understand about the compository, their uses, why it is used for the prosthetic limbs, why not in some other way. So this is very important aspect of the use of composites. The next one is biomaterials. Now these biomaterials generally they are the examples of collagen and various biodegradable polymers, PLA and PGA. So generally they are used in the field of tissue engineering sciences, wound dressing. So when we want some healing part, when we want to synthesize some collagen and the fibrous tissue, epithelialization, and when we want the formation of new blood vessels, angiogenesis. So generally in that way we want such materials which are very flexible, which need some synthesis, which make some collaboration, which make some what we can say the networking in between the two different tissue and the cellular compartment. So for that cellular compartment and the tissue, we want such material which are very flexible, which are need or which may be used for the purpose of synthesis, which may be used for the purpose of healing, which may be used for the purpose of repairing. So these are the biomaterial. Next is the smart and the nano materials. Generally, this smart and the nano materials are the examples like shape memory alloys, the nanoparticles. So again, these are the smart nanomaterials. So they are used for the main important use is the targeted drug delivery, medical imaging, stents. So generally, these are nanomaterials. So nowadays, now we have nano medicine, we have smart medicine. So in previous time we have in general cluster group of medicine. So they are not going to act on a particular viscera, they are not going to act on a particular part of the body. But now through this nanoparticle or the smart material, now they are going to act on a particular cell entity, they are going to act on a particular tissue. So this is the smart action. So it is very specifying. Okay, so nowadays now we have rather than chemo we have nanomedicine. So this nanomedicine is more effective than the chemotherapy, because chemotherapy it acts as a general, it acts on both mental, physical, particular, as a general person as a whole. So but this nanoparticle nanomedicine, it is not going to work as a holistic approach, it is going to act on a specific part. So that's why it is known as a smart materials or the nanomaterials. The next one is nanomaterials in medical field. So generally these nanomaterials, generally when we talk about their dimension, so it is 1 to 100 nanometer. Okay, and when we talk about in micron, so it is 0 to 1 micron. So this is the range of nanomaterial. So what is the range of nanomaterial? In nanometer, it lies in between 1 to 100 nanometer, whereas in micron, it lies in between 0 to 1 micron. So it's showing a unique physical property, unique chemical property, unique biological property. So these are the various properties and the actions of the nanomaterials, because they have a very finer action. They are very minute and very invisible structure. So because of that invisible structure, because of this minuteness, their action is very specific. Their action is very, what we can say, specifying to a particular specific cell. So this is very important part of the nanomaterial. They are very smart material. They are very what we can say, sharpened in their action. So why they are sharpened in their action? Because the size is very less. Suppose if the A particle having more size than B particle, there are two particles A and B. Suppose the size of A is more than B, so the action of this A is less than B. ठीक है, so the size of particle is inversely proportional to the action of that particular particle. That's why we want potentization. Now this is the beauty of homeopathy. Why we do potentization, why we do pulverization, why we do trituration, why we do succussion? Because we want to convert the mass particle into the massless particle. When we mix solute with the solvent, so it forms emulsion. Then with the help of force in acceleration, trituration, it converts into the micro emulsion. Then again it converts into the super micro emulsion. Then again it converts into the very small and minute piece or the particles which embodying with the different forces. And so this is all about the nanomaterials. So this is the beauty of homeopathy, that our homeopathic medicines are very minutest and very massless. So their action is very specifying and sharpened as compared to the cluster molecule. So this is very important part. The next is the major types of nanomaterial which are commonly used in the medicine. So these are gold nanoparticle, silver nanoparticle, iron oxide nanoparticle. So these are the commonest example of nanoparticle. Okay, arsenic nanoparticle. In our homeopathy now we introduce this arsenic nanoparticle because we have medicine arsenic album, ars iode. So this arsenic also plays a major role for preventing any type of toxicity. So this arsenic nanoparticles plays a very important role against ADR, that is adverse drug reaction, or any type of toxicity by the abuse of any particular drug substances. So this is the nanoparticles. Now where it is used? It is used for the targeted drug delivery, cancer therapy, medical imaging like MRI, CT scan. So these are the use of nanoparticles. Why they are used for such type of medical imaging? Because when we talk about CT scan, when we talk about MRI, so there are particular wavelength or a particular particle of that light which travels in a unidirectional flow. So this piece or this particle which is the carrier of that particular energy, so it needs some synthesis, it needs some flow in a unidirectional, it needs some uniformity. So because of that axis, they are going to make the vision on that particular viscera or the tissue or the biomaterial which is tissue. So generally this is the use of nanomaterial in the medical images. So this is MRI and CT scan. Okay, so generally these nanoparticles also plays a major role for the diagnostic purpose also, not only for the treatment. It is also used for the diagnosis of any particular disease condition. Okay, because nowadays when we talk about Western research era. So generally in New York, in USA, in Belgium, in Singapore, Malaysia, they are now focusing on the not only synthesizing nanoparticle. It is very what we can say not new one. They are also going to make what we can say the diagnostic tool of such nanoparticle. They are now creating many minute structure which are not only going to make their action, they are also going to make the filtration, screening, and what we can say the overall performance in the field of pharmacology. So this is the major aspect of the research work. So now in India, we want that type of research work. We want that type of facility, especially in our homeopathy. Rather than this Ayurveda and modern medicine, it is already well developed and accepted by WHO and the whole world. But homeopathy is still not accepted by WHO. Okay, so why it is not accepted by WHO? Because it is not a mainstream therapy. It is accessory part with the modern medicine. Why? Because ultimately we believes on the individualization concept. It is true, but we should always make a classification. We should always make a specificity in our drug selection, in our dosage selection, in our action of medicine, in our totality also. So this is the very important part which make homeopathy as evidence based medicine rather than plausibility phenomena, rather than water memory, rather than silica hypothesis. So again, this is very important research work, and we want that type of research work through CCRH collaboration. So we want that type of research work. These are our challenges. Nowadays, what are the limitations in homeopathy? The limitations are we have no specificity in the drug selection. We have no specificity in the dosage selection, which is the posology part of the pharmacy. We have no any specificity in the pharmacodynamic. We have no any specificity in the pharmacokinetic, which is again the branch of pharmacology. So there must be specificity. When there is a specificity, there is a unidirectional flow of the action of medicine. When there is a unidirectional flow of the action of medicine, then only we can make the propagation and the specification of the drug action. So this is the pharmacodynamic. What the drug does with the body. So this is the pharmacodynamics. What is pharmacokinetic? What the body does with the drug. So in both the aspect, we want the specification. Then only homeopathy accepted worldwide. Otherwise, it is only known as a pseudo medicine or placebo effect, magic effect. So we want that type of work in compared to the Western country because they are more rich in the research work as compared to India. Carbon based nanomaterials. Generally, they are carbon nanotubes. They are graphene sheet. So these are used for the screening purpose, like biosensor, tissue engineering, drug delivery. So for that, we use such carbon nanotubes, carbon materials, because they have that property to grasp and to reflect the source of light. So this is very important part for the carbon-based nanomaterials. The next one is now polymeric nanomaterials. These polymeric nanomaterials, generally they are the PLGA nanomaterials, the polymeric materials which are generally used for the drug release system, gene therapy, gene expression, genomic theory. So these are very important polymeric nanomaterials because they have efficacy on the deeper penetration. So the materials which have that capacity to act at the very innermost layer and the innermost core part of the tissue. So we use this material as a nanomaterial. This is polymeric nanomaterial. So again, this is very important for genomic expression, for the gene therapy, for the drug release. So this is the polymeric nanomaterials. The next is the lipid based nanomaterial. The lipid based nanomaterial, generally these are the examples of liposomes, solid lipid nanoparticles, and these are generally used for the vaccine delivery, chemotherapy. So this is the basic aspect of lipid based nanomaterial because we want a media. What is lipid? Lipid is a media. So for any drug delivery, we want that media. and that media should not affect the drug property. That is the basic aspect of lipid based nanomaterial. So when we use this lipid based nanomaterial, so they make a what we can say, a platform, a vehicle or a media to explore the action of drug particle. So this is the only media. So that's why in a vaccine preparation, in chemotherapy, in chemical drugs, we use certain media, and this media is a lipid base, because that lipid make the conjoint action with the main drug. So if this is the lipid based material, and when we what we can say, disperse some nano tubes or nano material or microstructure in such lipid media, so this will make a entanglement of solute with the solvent system. So this solvent is the lipid and the solute is your drug substance. So when they unite together, so they will give you the specific action, that is the smart action, that is the smart nanomaterial. So this is the lipid based nanomaterial. The next one is nanoceramics. Nanoceramics, generally they are the nano hydroxy albumin, what we can say, the various aspect of bone regeneration, the dental implants. So generally these are the nanoceramics. These are used to provide the rigidity, to provide the hardness, to provide the strength, to provide the specificity in their alignment. So this is the nanoceramics. So this is very commonly used for the bone regeneration and the dental implants. So implantation for artificial aspect. So this is the nanomaterial. This is nanoceramics. So these are basically the combination of hydrogen, oxygen, carbon, carbon, hydrogen, oxygen, carbon, carbon, hydrogen, carbon, carbon, oxygen, hydrogen, hydrogen, oxygen, oxygen. So these are the different what we can say, the propagation of the elementary detail. So this elementary detail will give you the different significance of such elementary composition in a different pattern, in a different composition, in a different concentration, in a different valency, in a different atomic percentage, in a different molecular percentage, in a different isotopic percentage, in a different form of their what we can say, the molecular compository. So this molecular compository always plays a major role in the nanoceramics. So what is nanoceramics? Nanoceramics is the compository part of all this molecular composition. The molecular composition of carbon, the molecular composition of hydrogen, the molecular composition of nitrogen, the molecular composition of arsenic, the molecular composition of some other basic elements. So these are the nanoceramics. The next one is, now this is the quantum dots. So this quantum dots, this is the semiconductor, the nanocrystals, because they are act on three dimensional. Okay, X, Y, Z. This is one place, this is another plane, X and Y. Now this is 2D. In three dimensional, now there is one axis along with this X and Y, that is Z axis. X, Y, Z. So this three, when they unite together, then this 3D model, generally it is used for the quantum dots. So this quantum dots plays a major role in the bioimaging and the disease diagnosis, the screening of disease. So this is the quantum dots. These are generally the semiconductor nanocrystalline materials. So these are used for the biofilms. Okay, for any type of film and for any type of what we can say, the fingerprinting, we use this quantum dots. Suppose if we talk about the MRI bioscanning, CT scan bioscanning. So for this, there are certain nanomaterials which are going to reflect their imaging on the three-dimensional view. So this is the quantum dots. Why it is called dots? Because they make an alignment by 1, 2, 3, 4, 5. So suppose 1 aligned with 2, so 2 aligned with 3, 3 aligned with 4, 4 aligned with 5. So this is a chain. So this is a quantum dots. So this is the bioimaging. The next is the advancement of the nanomaterials in the medicine. Now, what are the advancement in the field of this medicine? Again, target specific treatment, nanomedicine, which is now very popular. You know, so not only in homeopathy, In allopathy also they accepted individualization. They accepted smart medicine. They accepted specific medicine. Next is reduced size effect. In decrease their size, decrease their morphology. So when the size decrease, the action increases. When the size is more, the action is less. So this is inversely proportional. Enhance imaging and diagnosis. Enhance imaging and diagnosis means to increase the imaging technique, to make the specific diagnosis on that particular tissue, on that particular cell. So this is the enhancement of the imaging and diagnosis. The next one is the improved bioavailability. The improved bioavailability means to enhance their bioavailability, to enhance their biotransformation. So what is bioavailability? The concentration of drug substance which is present in the blood stream. This is the bioavailability. So again it is question mark in our homeopathy. When we talk about bioavailability in homeopathy, so again we are unfortunately not going to explain in a very specific manner because we have no specific posology, we have no any PD and PK model, which is the part of pharmacology, which is the part of pharmacy. Okay, so improved bioavailability means to have the specific concentration in a blood stream. So this is the evidence based medicine. Okay, so this is very important part and the advantages of the nanomaterials in the medicine field. Next is what are the disadvantages? What are the challenges? The major disadvantages: possible toxicity, high cost, complex manufacturing. Because ultimately, even though in our PIHR, when we talk about student research activity, we have home research unit. So this home research unit we started this with the various student centric research activity, teacher centric research activity, faculty student research centric research activity. So these are the very important aspect. So what we found that for making nanomaterials, for making such smart materials, we want a very large budget. Why? Because we want to procure some heavy materials, various chemicals, various synthesizer, various enzymes, various artificial products. So these are used to synthesize nanomaterial, and various instruments also, which are very highly sophisticated. So these are very what we can say the complex manufacturing technique, and it require very high cost. So again, in our Parul University, we have micro nano lab, we have electron microscope, we have scanning electron microscope. Now we are going to procure TEM also, that is transmission electron microscope. So this is very highly costful. So in a single college, when we talk about single college or any some specific area, so it is very difficult to make such what we can say the high bridge of research at the level of nanomedicine. So but for deemed university, for some other international university, it is easy and what we can say possible to make such research work. So again we want that part. So this is the disadvantage. The next one is the nanomaterials, their classification. So in terms of size, in between 1 to 100 nanometer, so there are nanoparticles which are used for drug delivery, liposomes which are used for vaccines, the carbon base which are used for the biosensor screening purpose, the nanoceramics which are used for the bone repairing because it needs some strength and the specificity in their alignment. So this is the nanoceramics. Next is the cancer therapy. So again, nanoparticles are generally used for this cancer therapy also, for specific action also, like nano medicine in terms of destroying the cancer cell rather than some other somatic cells. So this is the specific action of nanomedicine in the cancer therapy. Lysosomes also used for this chemo purpose. Carbon based biosensor also for the tissue engineering, and this nanoceramics also for the dental implantation. So this is all about the various uses of the different types of nanomaterial or the smart materials which have different range, which have different chemical property, which have different physical property, which have different therapeutic property. So this is all about the basic aspect of different different smart and the nanomaterial with different types and their action. Next is drug delivery system or the nanoparticle. So generally, first is the drug. So what is drug? It is the raw and the crude material which may be prepared by plants, which may be prepared by animals, which may be prepared by the synthetic part, which may be prepared by the disease part, which may be prepared by the healthy part, which may be prepared by the source of light. So this is all about the drugs. So when drug loaded into a specific structure, so it forms nanoparticle, because nanoparticle is a very minutest and drug is a coarse part. So when we talk about drug and nanoparticle, so the drug should be united with the micro and the minutest form. So this minutest and the micro form is because of the force in acceleration. When we do trituration, when we do pulverization, when we do succussion, when we do digestion, so this is what? This is the conversion of coarse particle into the minutest particle, into the microfilaments, into the invisible structure, into the super micro emulsion. So this is the formation of nanoparticle. Now this nanoparticle, when they travel into the blood, so they reach up to the target cell. So this is our target cell. Okay, maybe lymphocytes, maybe B lymphocytes, maybe T lymphocytes, maybe somatic cells, maybe because of any epithelial cells, any squamous cell, any cuboidal cell. So this is the target cell, because we already learn about the nanoparticle having specificity in their action. So the specificity is always in terms of their specific action, sphere of action, area. So this is all about the target cell. Afterward, it release the drug system in a disease aspect, because ultimately we want the therapeutic part. We want that action towards the disease orientation. So this is about the drug delivery system with nanoparticles. Next is the biocompatibility. This biocompatibility, medical materials, it is the ability of materials to perform its intent medical function without causing harmful reaction in the body. So this biocompatibility is generally the ability of material to perform its specific action without any harm, without any ADR in the human body. So this is all about the biocompatibility. This is the medical material. So this is a bioavailability. What we can say, the biotransformation. When we make such availability, when we make the compatibility in the biomaterial, so they are definitely showcasing their sharpened action, a specific action, okay, which is well defined. So action should be well defined. So this is the biocompatibility. Next is the what is biocompatible material? Does not cause any toxicity. They are triggering to a specific immune system. They are generally work on a safer side, like with the blood stream, with the tissue, with the cell, with the bone. So these are the biocompatibility. So these are very, very important, meaningful part of such strong and what we can say the biocomposition. So this is the basic aspect of the biocompatibility. This is the uniqueness of biocompatibility, how it differs from other materials, how it differ from other smart material. So this is biocompatibility. Next is, now this is factors affecting biocompatibility. So there are different factors which are now going to affect the biocompatibility. So what are the different factors which affecting the biocompatibility? The number one is the chemical composition. So here this chemical composition is what? So chemical composition is basically the composition of different chemical ingredients for making a specific orientation of material science. So this is the chemical compository. So it may be because of the carbon element, it may be because of the conjoint property of carbon with nitrogen, it may be because of the conjoint property of carbon with hydrogen, it may be because of the conjoint property of carbon with carbon, it may be because of the conjoint property of some other element like arsenic with oxygen, arsine. Okay, so generally this chemical compository plays a major role. So this chemical compository, it defines a specific action, because every element derived with a specific source. So because of that specific source, they have a specific physical property, they have a specific chemical property, and because of this specificity and their physical property in their chemical property, they are going to show their specificity in their action. When there is a specificity in their action, then ultimately they are showing specificity in their union. When there is a specificity in their union, so ultimately there is a specificity in their target action. When there is a specificity in their target action, so there is a more healing part, there is a more recovery. So this is all about the chemical compository of the biocompatibility, the material science. So this material science is a very huge branch. It is just like a sea. So you can find out n number of material, you can find out n number of elements. So there are n number of elements with n number of properties with n number of action. So this is the chemical compository. Next is the surface properties. So what is surface properties? So generally when we talk about the roughness, the coating, the layering, so this is the surface property, because this properties resemble with the superficial part, not with the deeper core aspect of that particular material science. So this is the surface property. So this will give you the layering, which protects from the light, which protect it from the some other stimuli, which protect it from some other what we can say, the smell, the radiations. So this is the surface property. Again, this surface property also resemble with the properties of cell, properties with the some other tissue, properties with the bones, properties with the alignments of various tissue. So this is the surface property. So this is very important part. There are certain elements which make that surface property, which make hardening, like carbon. So when we put carbon over the tissue or the cellular event, so it make a pseudo layer which is very hard. So this is the surface property of carbon element. Okay, when we put hydrogen over carbon, so it is not hard, so it makes what we can say, flexibility in the hardness, because it is a water. So generally this hydrogen, when it attracts with the oxygen, when it binds with the oxygen, so this is basically the flexibility, or what we can say, the smoothness in the hard structure. So this hydrogen, oxygen, and the carbon, they have different elementary composites, they have different atomic percentage, they have different molecular percentage, they have different fraction in their dosage, in their propagation, in their orientation, in their arrangement, in their heterogeneity. So this is about the surface property. The next one is the corrosion resistance. This corrosion resistance, generally it is a basic reactivity in between two different elementary composite. So when there is A and B, so when this A react with B, so this forms corrosion. So generally corrosion is what? It is not the material part, it is the reaction part of that different material, the material of A and B. So this is the corrosion resistance. So when we mix C in between A and B, so they are not going to make any type of reaction. So this C is known as the corrosion. So this corrosion, generally it prevent the corrosiveness, it prevent the reaction between the A and B. So when this A unites with B along with C, so there is no reaction, it is neutralizing the reaction of A and B individually. But if there is no C, so when it combines with A and B, so definitely it forms certain reaction. This is the corrosion. So that's why in certain materials we use coating. So this coating prevents corrosion, because if there is no superficial property, if there is no coating and the pseudo layering, so it forms corrosion, and because of this corrosion there is a roughness, there is a hardness, and because of this the action decrease down. We don't want this decreasing of action, we don't want this what we can say, the uh, specification in their action of that particular material. So this is the corrosion, this is the corrosion resistance. So it is again because of some elementary part which neutralizes the action of A element with the B. Next is the wear and degradation of the product. Now what does it mean? Wear and degradation product means when we have certain element or the compository element which degrade or decrease the size of that particular materials, it is the degradation product. So generally we use certain materials which neutralizing the action of nanosmarts or the nanoparticles. So this nano gradation and the degradation of such material science is very very important aspect of healing, because if there is a degradation of carbon element, if there is a degradation of hydrogen element, if there is a degradation of some other sulfur or what we can say the arsenic, so definitely the action will be more. So the degradation product plays a major part. So when there is a major action towards the size or the orientation of that particular material, it plays a major specificity in the drug delivery system. The next one is the interaction with the cells and protein. So what does it mean? When cell interact with the protein, so generally it forms a heterogeneous, it forms a complex. So this complex material is what? It is a material which forms by the union of different varieties of cell with the different varieties of protein. So this protein molecule, it makes healing, it make what we can say specific orientation around that particular cell, around that particular tissue, around that particular part of the body. So this is the interaction with the cellular event, interaction with the protein event, interaction with the cell and protein event, because these two are the different aspect of material science. Cells are different and proteins are different. So when we reunite the cells with protein, so it forms the major aspect of the biocompatibility. So these are the different factors which affect the biocompatibility. So on the basis of that, we synthesize nanomaterial, we synthesize nano, what we can say the smart materials. We not only synthesizing nanomaterials, we also showcasing their action in a specific area, in a specific part. Suppose when we talk about in vitro study, when we talk about in vivo study, animal model, when we talk about clinical model, so this is what? This is all about the drug delivery system. This is all about the drug development processing. So for any type of drug proving or pathogenetic trial, we should always start with the phase 0. So what is phase 0? Phase 0 is in vitro and in vivo. Okay, cell line study and the animal study. And what is phase 1? That is the clinical model. Okay, so for this type of system, we want that biocompatibility. And this biocompatibility always depends on the nanomaterials or the smart materials, which are very, very specific in their action. So this is the basic aspect of the nanoscience. So this is all about the nanomaterials and the nanoscience. Ultimately, this nanomaterials and the nanoscience also plays a major role in the field of chemical engineering, in the field of mechanical engineering. So this is very very important aspect in the different playgrounds of biocompatibility. So it is very huge, it is very large. Next is the types of biocompatibility. So there are three major types: bioinert, the bioactive, and the biodegradable. So bioinert, generally when there is no action with the body, so it is inert because it is not active. Okay, so this is the bioinert. Okay, like titanium, alumina, so they are not going to showcase any type of reaction with the body. So this is bioinert. The bioactive, this forms bond with the tissue, so they may react. So that's why it is known as a bioactive. As the name suggests, active. So they may act, they may show reaction. So this is the bioactive. The third one is the biodegradable. The biodegradable, generally it is the safely breaks down in body. So they are easily digested, they are easily broken down, they are easily get converted from mass into massless particle. So this is the biodegradable. Example is PLA and PGA. So this is the biodegradable. The next one is the importance in medicine. The importance in medicine, generally it is used to prevent implant rejection. It is used for the long term implant success. It is very very useful for improving the healing, for patient safety. So this is all about the basic aspect in the field of medicine. So that's why this material science and the biocompatibility always plays a major role in the field of medical fraternity. Now, where is homeopathy? So definitely homeopathy is very very important part for the dynamization, in terms of potentization, in terms of nanomedicine, in terms of smart material. So when we talk about the process of potentization, like trituration, succussion, so this is the process which convert mass particle into massless particle, or converting solid particle or solutant into a microfilament or the minute particle or invisible structure, which make union with the various isotopic molecules to form a specific action or smartest action in the tissue, in a specific cell, in a specific bio element. So this is homeopathy. So before knowing about this homeopathy, we must know about the material science. We must know about the various materials. We must know about the various sensor. We must know about the various nanomedicine, how the nanomedicine evolved, how this nanomedicine act, how these nanomaterials shows different action. So this is all about the material science in homeopathy. When we talk about homeopathy, so when we do potentization, so this potentization is a very meaning and very important aspect for making our medicine more and more, what we can say, smartest in terms of their structure, in terms of their bioavailability, in terms of their biotransformation, in terms of their pharmacokinetic, in terms of their pharmacodynamic, in terms of their pharmacological action, in terms of pharmacognosy. So this is all about the important aspect of potentization in homeopathy. So when we reduce the size with the force in acceleration. So what is force in acceleration? When we do trituration, when we do succussion, strokes. So this is what? This is force in acceleration. So that force in acceleration convert mass particle into the massless particle. And when this massless particle unite with various isotopic molecules along with some electromagnetic properties and some other static properties, so this will give you a specific action on a specific bio weapon. So this is all about the material science in homeopathy. In later on in next presentation, definitely we discuss about how this nanoparticles, how this smart material and the nanomaterial synthesized. So this is very important part. It is a part from pharmacy. So maybe it is very difficult to explain and to accept this. But again, in next session, we will discuss about the preparation of a smart particle, how it prepare, how it synthesized by different enzymatic action, by different chemical and mechanical action. So in next lecture, we will definitely discuss about this nanomaterial, synthesis of nanomaterial. So this is all about today's presentation. Thank you so much. Hello. Yes, sir. Any question regarding with this presentation? Hello.
Yes,
Sir.
it was really a very good session, sir. You really show the beauty of research work in this field and how one can understand how it works like that. But, yes, Dr. Manoj, please unmute.
Yes, thank you for a nice presentation, and I must congratulate your attitude towards studying more science. And we must learn that, or we must not forget that. Well, all these can be achieved through the fertilization. Well, that the quality or the ability of fertilization is yet to disguised by the medical world. But we have already done all these things. The making the substance into biocompatibility by using the fertilization. Then again, another thing is that we know how all these things happens. Without the vital force, it will not work. these are conditional. As you said, this biocompatibility or this things or that things, etc. Very good. But it all happens where? Only in a living being. Otherwise, it will not work. So homeopathy, it thinks more than the modern medical world. So anyway, nice presentation. Congratulations for your endeavors. Thank you.
Thank you, sir. Uh,
Is there anyone who would like to ask
Yes,
any
Dr.
questions?
Yes, Dr. Ambrose, sir.
Thank you, Dr. Danesh ji, Arya, and Namaskar, Dr. Manoj ji, Abdul Salam ji. Congratulations, Dr. Suraj Singh Bhadoria. Suraj Singh Bhadoria is a dynamic personality, IFPH, and research work, field pharmacy, homeopathic pharmacy, or very large discussion. Homeopathic pharmacy. Homeopathic is a dynamic science. Homeopathic is a nano science. Homeopathic is material science. So, a smart material science. So, homeopathic main cause of disease, homeopathy, vital force drain. Vital force is invisible and nanoparticles is invisible. So homeopathic science is a nanoparticle and dynamic science. Very, very thanks, Dr. Suraj Singh Bhadoria. Thank you.
Thank you, sir. Thank you so much.
Thank
Yes,
you,
Dr.
sir.
Yes, yes. Is there anyone who want to have a question to Dr. SURAJ Singh Bhadoria? So, Dr. Binoy, do you have any question or any suggestion?
And I think the bio-inert material you mentioned about, I think the role played by the sugar of milk, or up to a certain extent we can say alcohol, it becomes bio-inert, isn't it? What is your comment on that, Dr. Suraj?
Sir, basically, nowadays we enter into in vitro study. So when we use this alcohol as a bioinert, but ultimately it is false, because ultimately alcohol also showcasing some antibacterial and antifungal properties also. And when we talk about this sugar of milk, so again, when we do this clinical study or some other animal study, animal model, so when we have this control group, so again, this at certain level, this is not like a inert. At certain level, it is going to showcase some action. So again, sir, I want to add some new thing. It is not complete presentation. We also want to do more and more research work against such inert substances.
Yes, yes.
Maybe they must they show some more action. So the vehicle, suppose if we talk about alcohol, there are different types of alcohol: strong alcohol, absolute alcohol. So we can't say that it is inert, because ultimately, suppose in hair oil we use mustard oil, we use coconut oil. So this coconut oil and mustard oil, it is not inert. They already shown some antibacterial property. They already shown some antifungal property. There are so many literatures. So these are not inert substances. That's why the today presentation, the main aim is, first we must know about the material science, then we enter into homeopathy, because ultimately we are BHMS doctor, then we enter into MD and then PhD. So we want to have that particular specification or specialization in homeopathy. So then only we can conduct many research work with the inert material, and afterward then we know which material is more inert or not in that particular classification. So this will be maybe our upcoming, what we can say, the challenge in homeopathy.
Yes, all the
Thank
best
you.
for your endeavors. Okay, thank you.
Thank you.
Okay, Ms. Arya, you can conclude the session.
Thank you, everyone, for joining us on this webinar. And thank you, Dr. Suraj, sir, for giving us an insight into this topic. And thank you once again to all the members of this webinar. And a short reminder that in case you have missed any of the videos or the sessions, it's daily being uploaded in our YouTube channel IFPH Talks. And with that, I conclude our session today. Thank you.
Thank
Over
you.
to
Thank you. Ghar ghar homeopathy, ghar ghar homeopathy. Homeopathic is a
okay, sir.
holistic science.
Thank you. Thank you to all, sir. Thank you, sir.
Thank you. Now it's up to to Dr. Mariamma John to moderate the Malayalam session.